Thank you for staying. I'm just going to explain to you what we're doing in Leeds in terms of citizen engagement and how we're delivering technology change through working directly with citizens. So in Leeds, what we're doing is we're looking to create an age-friendly smart city. We want it to be the best place to grow old, so that's our purpose that was just described. We're really focused on really making a difference in Leeds for people that are, as they grow old. And we've got a context that's described there around social isolation. The figures are really stark in terms of how big a challenge that is. Leeds' population is almost 800,000 people. And as you can see there, we've got 20% of people are sometimes lonely, 10% are intensely lonely, and that actually equates to 15,000 people in our city who really feel extremely socially isolated in whatever circumstance they live. And when we look at the health and social care sector, particularly the costs of that, as you can see there, in the acute sector, in hospital admissions, in accident and emergency, costs are massive when people get into those different circumstances. And what we're trying to do is support people to stay at home and actually live a better life through the experience that they have. We're looking at the minute if you look at this slide, it demonstrates that when you're in the health and social care system, people tend to be looked at as the individual parts. So you may be going to see someone about your eyes or your heart, or you may see an occupational therapist about how you walk and physically get about. We don't tend to see the person as the whole person. And what we're looking at is really transforming that and looking at how that person interacts with their family and their friends and society and actually lives their life, which hopefully then gives them a better life outcome and reduces their dependence on the health and social care system. When you work with people in vulnerable positions, it's not about us versus them. This is about us working with people in collaboration and working with them to create a solution that meets their specific needs. The biggest lesson that emerges from this is when it comes to attitudes, behaviours and perceptions, if we want to create genuine change, we have to focus on the people and understand what actually motivates them. So this all starts from those conversations around what it is that people need to live their lives. And then technology solutions follow that. Technology is not an excuse to do something to someone. We're using it in positive relationships and interactions so that everyone can benefit. And take time to observe, discover and listen to what people are saying their requirements are, so that we actually meet those and things are really benefiting people. So what did we do? With those things in mind, we started our journey by asking how do we create an age-friendly smart city? And there's examples across the world of different ways technologies actually address a smart city. We don't want to create a brand new city with smart technologies. That's not what we're about in this arena. And we're looking for the many, not for the few. So we're trying to think about all the things that are going on across the world and actually use the experience that we see. And we've got a project that includes the Internet of Things, wearables and open data. It's basically focused around our communities, about people and what matters to them, about individuals and the individuals in their neighbourhoods and the circumstances that surround them. And with that in mind, we've been searching for inspiration across the world, and we've found that in many surprising places. And here's just one example. So in the Netherlands, there is one area where there's one Dutch province with its own language. And what they've done is they've put a bus in place for that population with a library of books that are available only in that language. And that's a very specific, tiny community, but it's really specifically focused around providing something for them. And the lesson for us in that is it's about really taking to the people the thing that they need within their community that meets their needs. And if we look in Leeds, there are various examples of stories that are around in Leeds. So as you can see there is small text. but there's something around the Black Health initiative in Leeds and the stories that they've got. There's a storytelling project in there. We've got a carer who's based in Leeds who cared for her father, and she's put a blog about all the things that would have been really good had they been in place for him when he was at the end of his life. And there's also Leodis, which is one of the neighbourhood networks across the city, who has 60,000 images of the city of Leeds, telling the story of Leeds. So what we're looking at is all the breadth of stories that are around in our city, and looking at how we can enable them. So our community focus is, can the Internet of Things allow us to use public transport as a hub for storytelling to increase social inclusion? So if we can get those stories out across the city, how could we create that opportunity for people to engage back with the city in those stories that exist across the city that's really rich information? One of the things we're looking at as an individual focus is, could we repurpose individual technology such as wearables like smartwatches, and instead of looking at them tracking people, could we look at them in terms of looking at someone's safety in our city and how they actually move around our city? So we're looking at how do we repurpose technology to meet the requirements of people across the city. In our neighbourhoods, we've got there's 14% of pedestrian casualties and 45% of pedestrian fatalities happening in older people across the city. What we're looking at is, could we use available data to make neighbourhoods more safe for people? So how can we actually address some of the real challenges we've got around people moving around our city and helping that social isolation to be addressed? And we've got lots and lots of opportunities and things that are going around that we really feel are real opportunities. So when you start thinking about a smart city in terms of individuals, communities and neighbourhoods, there's massive amounts of inspiration that we're building on. So how are we creating an agile smart city in Leeds? The answer is discovering about how we can empower individuals and communities through storytelling and making neighbourhoods safer. We're starting by bringing 3 key parties together, and without those 3 we feel that if you've got 1 or 2 of them, you're not going to get to the answer. So the real key is starting from having Leeds citizens in the room. We have service providers, and then we have technologists. So there's some real key developers who are sat listening to those conversations and thinking about how technology can answer real life problems. We focused on 4 themes: housing and social participation, health and access, transport and inclusion, and outdoor spaces and safety. So they're the 4 things that we're focused on. And our approach is working with age camps. So we're looking at getting people together in an unconference. So this is just a conversation with people. This is trying to get those parties to just talk about their lives, how they experience their lives, what problems they've got. And then we try and hone that down into something very specific. We have innovation labs where we have those conversations for the morning. We then find what something specific that comes out of that we can then put technology to solve a specific problem. And then we're moving into a community pilot to actually pilot that technology and then moving that through to scale. So this the first thing we've done. So in 2 months, we had an innovation lab. In the first 2 months of the project, we got a real outcome. So we had, there was a conversation where an older lady was looking to speak to her family and friends in Japan. And she'd been given an iPad. And as you can see on here, she couldn't quite work out how it worked. She was really struggling to use it. She didn't know what to press, and it was a bit complicated. So that was the starting point of this conversation. I'm really struggling to actually enable me to talk to my family. And what happened in terms of the conversation, using Mesh and using Raspberry Pi and Mesh, also lovingly known as, we came up with a concept which didn't didn't mean, it meant the conversation wasn't complex. The solution was nothing to plug in, no broadband required. It was just pressing a button and having a conversation. So that moved into developing what looks like a tissue box with a button on the top. And as you can see, that is in a care home. So what we've done is we've taken that very small conversation, which costs, I think Dylan mentioned it earlier, £3,000 to £5,000 from having a conversation, having an innovation event, picking up a real life problem, and then getting to a solution within a very short space of time in an agile sense. And that's been transferred from not just that person who couldn't have that conversation with their family overseas, but also in a care home situation where people are in individual rooms, can't get out of that room, but they live in a nice isolated environment, even though they live with other people. And that's really transformed people's ability to talk to each other within different rooms, and we've really brought that to life for people. So we're actually changing the way people's lives are happening with very, very simple technologies. And it doesn't end there, this is just the start. So we're moving on. The next thing we've looked at in another innovation event is someone was saying, an older lady said, I'm really struggling to get to the bus stop. By the time I get to the bus stop, the bus is every hour, and I've got to wait for 45 minutes. I'm really cold, I can't stand very well, and then I go home and I never actually get out. So by taking the data from the bus stop, which says when the bus is due, we've put a little gadget in someone's home with red, amber and green. So we've taken the data from the bus stop that says when the bus is arriving. So that person knows that if it's on green, it's worth setting off to the bus stop because she knows she can get there. If it's on amber or red, she knows that it's not a time to set off. Really, really simple stuff, very, very basic. Things that you're probably thinking, that's just a real no-brainer. They're really simple things, but they're actually transforming the way people are living their lives and actually bringing real benefit to significant numbers of people in the city. So we are starting to bring other people together. So we've got technologists, library services, sheltered housing. We're moving on through transport and bus stops. And you know, the opportunity is endless. We're also working with telecare, telehealth, everything tele, so tele-X, tele-everything. And our aims and outcomes for that are exploring the use of technology to inform procurement in the future, transforming health and care in using digital technology, and helping our Leeds pound, which is the health and social care budget, basically, bringing that together and making sure that that goes further in terms of productivity. And we're doing that in an agile way, so we're looking at moving from pilots and prototypes through to through that circle of through to evaluation, so that we're learning as we're going through that, so that we make sure that it is fit for purpose. We've got a pilot outcome at the minute with the aims are reducing social isolation and loneliness, empowering and giving control and self-care, and reducing unplanned contact with medical and social care professionals. There's a picture of that in action. We've actually got this pilot up and running in 2 areas of our city, working with older people, giving them technology that they can use in their lives to connect them with their family and friends. So here's a sort of a technical diagram of that. We're working with several companies, this particular one's Echo, and what you've got is we've got people connecting themselves with technology that supports, that measures things about their health, with their family, connecting them to their family and friends, and connecting them through into GPs and the health sector. So it's that circle of care, so we're bringing together all information about that person and helping them to connect socially with their family and friends. So it's that whole thing. Participation feedback's been really, really good. People have really felt that technology's enabled them to actually move on in their lives. Meeting people, engaging socially with people. I think one of the key challenges originally is the basic things like older people don't always have broadband in their own home. So there's been some teething problems at the beginning in terms of getting some of those things set up. But once we've got over those hurdles, people have really got used to this. And the feedback has been really, really positive. There's been real positivity around being able to have conversations and it being fun. So people have really engaged with it and enjoyed it. So really to sum up that, what we're looking at for our city is being agile, creating new opportunities, using technologies in different ways, but it's really about listening and co-production. This is about people, but it's about going back to our purpose of trying to make Leeds the best place to grow old. So Leeds is our lab, and technology, plus rich, messy, exciting, complex, intricate lives, gives us genuine insight, new connections and real solutions. Thank you very much.
Hi Julie, Mark Socitm, UK Authority. Just want to give you the squeeze on public finances as hitting local government harder than ever. What's it like making a business case to justify the investment in a lot of these projects?
I think the thing is, I think the thing is, what we recognise is prevention is a really big part of health and social care. If we can support people to live their lives and not fall into the system, to the expensive system, which that second slide on my slide deck demonstrated, then there is an investment case to support people to live their lives, self-manage and reduce the impact until a later date on the system. So there is a real genuine case for prevention and early intervention in health and social care.
Yeah, have you been able to put numbers on whether it's the kind of overall programme or individual parts of it to justify it?
What we're looking at in the ECHO specifically, we're looking at real proper university analysis of the project, so that before we actually move to scale, we have some real hard evidence that shows what we've actually achieved. There's very early signs of reductions in visits to hospital, visits to GPs, which all cost significant amounts of money in the system. So in terms of the investment case, we do believe that is stacks up at the moment.
There's a gentleman a couple of rows in front of you, had his hand up there.
Hi, Steve Cliff, Socitm Leadership Group. Great presentation, really inspirational. And I'm curious, kind of a similar question, but what was as you said, the technology is not the challenge here. What was the catalyst that actually changed you from being maybe how you used to be as a city council to be in this space that you are now? What had to change? What was the catalyst to change what might have been an old culture, old ways of doing things? How did it happen?
How did it happen? Leeds came together as an informatics board across health and social care, and we have some real digital leadership in Leeds, I think, that comes together as a strong, cohesive unit. We've got aspirations in terms of how we change the way we operate at the moment, addressing that huge challenge of increasing demographics, decreasing budgets. And I think it's the sum of the parts working across health and social care together as a strong unit. We have an integrated intelligence team now. We have very strong working relationships in terms of driving roadmaps across the city for innovation. And we have a smart city board within the council. So Leeds has got lots of things that come together in the city. There's Health and Social Care Information Centre, Department of Health. So we have real strength in the city in terms of people and where things are co-located. But I think it's about our aspirations from our Health and Wellbeing Board. Our political leadership is really driving the agenda around, the best place to grow old as one of the 7 breakthrough projects. So we have political leadership, we have digital leadership, and I think those things are really significant.
I love the way you say we, and it's not like one visionary who's trying to drive this. I love that. Thank you.
Any more questions for Julie? Down here on my right hand side.
Hi there, sorry, Neil Merritt for Government Computing. I was going to ask, in the specific examples you've given already, have any of those projects, are they still all pilots at the moment, or are there any sort of clear plans at present for a sort of wider rollout? And I was wondering what sort of capacity is possible to put sort of a number in terms of anticipated users that you expect to sort of see, hopefully being able to use that technology as well.
I think what we're doing is we're looking at creating pilot opportunities. We haven't got them to scale at the moment, but what we're looking at is where are the benefits and where can we actually replicate them. So the first one, in terms of that Pioneer Mesh, it started out with that initial conversation, and then we're looking at how can we partner to actually make that much more across the city. So we're looking at where the uses are for each of those individual opportunities. But we are running these innovation days on a regular basis in terms of creating different opportunities. So we're looking at multi-supplier arrangements across the city and bringing that investment into the city in terms of jobs, economy, as an innovation city.
Any more questions? Yeah.
My name is Jennifer from Hamilton District Council. It's a rural district council in North Yorkshire. And we heard so many stories from some, let's say, smart city examples, Bristol, Leeds, York this morning. And we can see as this city, you got government funding and you do incredible job, and some of the services you provide are very, let's say, cutting edge, pioneering. My question would be, some of the services you provide actually, if you just simplify it, it's kind of has a lot of commercial potential. So for the rest of the authorities sitting in the room or across the country, is there possible, probably this question not asked Leeds, probably asked government level, is it possible we set up a kind of platform can share this app to as you said, replicate it, and we make the best of the funding. Whatever city benefits it, actually, it can share that among the communities.
I can answer that. In terms of Leeds is a pioneer, one of, I think, 14 original pioneers. There are now vanguards as well across the country in terms of health and social care. And what we're doing, we came together as an pioneer informatics team, and what we've put together is a whole programme of projects. So these are projects once for all, so the NHS, you'll not need me to tell you this, the NHS and the secure email, all those things. And they are all once for all. So replicating them across the country and setting them up so that they can be used in a simplified, standardised and share methodology, which we use in Leeds, and we've brought to that pioneer programme of projects. And open source, open standards, and creating the opportunities so that we can actually share those things across. And it's not just things that are happening in Leeds, it's things that are happening across the country, because this is about us really working together. Because for us to achieve what we need to achieve in local government, we really do need to be consolidating that and sharing things openly so that we work together for the people of the country.
Thank you. So in this sense, is there possible some organization can take a lead, for example, get the information from various councils? Actually, this project is ongoing, and in 1 or 2 years' time, it can be shared. So if we kind of roadmap this, then actually we can wait 1 or 2 years rather than invested this particular service now. We wait, and the other service actually there isn't anything in the market, then we can, it's our priority, we do it now. So is there kind of mechanism in place? Probably I asked the question too big.
Yeah, as I say, I think the pioneers will be publishing some of the things that they're doing in terms of that simplify, standardise and share, doing once for the country. I think also the National Information Board strategy framework, personalised health and social care, in terms of the roadmaps that all areas have to produce, will all be shared nationally. I think coming out of that will be opportunity to look at where each area is differentiating and where the things that can be shared openly from different areas will hopefully come out from that.
Thank you.
I hope.
Any final questions?